Do you or your partner suffer from erectile dysfunction? Is erectile dysfunction affecting your sex life? I know this is a difficult topic to talk about. It's such a stressful and emotional topic that doesn't just affect you in the bedroom, it can affect you in everyday life. After watching this video, you'll have a much better understanding of erectile dysfunction and the treatments available to help. Stay tuned as I'll be talking about the most common causes of erectile dysfunction and exactly what you can do to treat it and how to treat it so you can live a better life and have a healthier sex life. My name is Jeffries. I'm a registered nurse here in Los Angeles, California with 15 years experience in education and emergency room nursing. So, what is erectile dysfunction? Erectile dysfunction, we'll call it ED for short, is also known as impotence. It's the inability to get and keep an erection long enough to have sexual interactions. ED is a very common condition amongst men and not talked about enough, mostly affecting men in the 40+ age range, but can affect men of any age. In most cases, the episodes are caused by stress, anxiety, lack of sleep, or excessive alcohol intake. For some men, this can be an isolated episode, which can self-resolve and are often nothing to worry about. However, if you find that you or your partner are regularly suffering from ED or erectile dysfunction, this may indicate a more concerning medical or psychological problem. In some cases, ED may be associated with medications that you've been prescribed by your doctor. So how will your doctor know what the causes are? So during your consultation, your doctor will take a detailed history as there are many things that can increase the risk of development of ED. So each factor needs to be addressed individually, so remember that. Lifestyle factors that can cause erectile dysfunction include being overweight, smoking or have a history of smoking, excessive alcohol intake, or illicit drug use, like illegal drugs. Your doctor will also want to review your mental health. They'll look at your anxiety and your stress levels because they can dramatically influence your ability to get and sustain an erection. Also, for some patients, having a hormonal imbalance can play a role, such as having a low level of testosterone or suffering from diabetes. Prescribed medications can also cause ED, such as antidepressants, antipsychotics, as well as certain blood pressure medications, and also commonly used for prostate issues, testosterone blocking medications. If you have a history of cardiovascular disease, this may also indicate that the blood vessels supplying the penis are affected. If you've had experience of a new or old injury or surgery to the genital area or any conditions which may affect the nerve supplying the penis, such as a penile fracture, some trauma, your doctor will also need to examine you and your genitals. Treatments for the management of ED are effective for many patients. However, it's important to know that the management of each patient's erectile dysfunction is individualized depending on the cause, because there are many causes. For example, the treatment is likely to be different where stress and anxiety may be the main cause, and you might benefit from psychosexual therapy, where you'll be given the correct tools to manage your anxiety and stress levels, which in turn will improve your mental well-being, but also the symptoms of the erectile dysfunction. Your doctor, if relevant for you, will discuss the importance of improving lifestyle factors, such as reducing your alcohol intake, stopping smoking, and avoiding drug misuse. Also, keeping your weight at a healthy level can be beneficial, and a dietitian or your own doctor can help you with this. So what about medications? So you've probably heard of Viagra, also known as sildenafil. That's one of the most famous medications to treat ED. This is a medication that's available on prescription from your doctor. These medications are taken prior to intercourse and are effective for around 3/4 of patients. Please don't buy over-the-counter Viagra from the gas station, petrol station, or Walmart. These products can have some really dangerous ingredients in them, and I wouldn't recommend it. Another alternative to treatment is a vacuum pump. Vacuum pumps work by sucking blood to the penis, and this may be an option prescribed by your doctor for someone who has not had great success with medications or other treatments. Just a warning though, it can be a little bit traumatic and cause a little bit of bruising. There are also surgical options. These surgical options exist in the form of penile implants. However, they come with surgery and their own list of risks, and this option is usually reserved for those people where other treatments have failed. If this is something that you wish to talk about or pursue and you've tried all other options, you should discuss this with your regular doctor so a referral can be made to a specialist. If there's anything I didn't cover on here or you have any questions, please let me know in the comments below. For tips on how to get a better night's sleep, which will also help your erectile dysfunction, click here to watch the next video, which is going to dramatically improve it.